Hello friends, I'm Virendra Jain. I'm consultant radiologist at Royal Derby Hospital. I'm going to talk a little bit about radiology, how to go about this subject while preparing for your NEET exam, AIIMS exam or MCA exams. So this is very small subject. So as you all know, radiology, usually you do not expect more than 7 to 8 questions. And this is what even I used to think while I was preparing for my exam. But what I realized when I got into MAMC radiology, that if you understand the concepts of radiology well, this is probably one of the most important subject, because if you know the concepts well, you just not won't be able to answer just the radiology questions. However, you can answer a lot of questions which are from medicine, surgery, gynae and pediatrics as well. So the best way to go about it is read the general radiology first, and then go for the systemic radiology, because when you will finish the general radiology, you would know the concepts of ultrasound, CT scan, MRI, that what you need to understand in terms of principles, in terms of why that particular disease or why particular sign appears like bright or black on ultrasound and while other appear white or vice versa on CT or MRI. If you understand the principles and the understanding about these CT scan, MRI, ultrasound, X-rays, you would come to know that there are certain rules which you can follow. And if you read those keywords into the question, even if you do not know much about the disease, you would be able to answer a lot of questions. So what I stress, that if you can understand the principles well, you should be able to answer almost 18 to 20 questions easily, not just from radiology, but from the other branches as well. Not just taken into account the principles. If you start discussing about one-liners which are asked, like why that particular sign is known as on MRI, or why that particular sign is known as on CT scan. If you start counting on those questions, you should easily be able to do around 25 questions just from the radiology itself. So what I have done in this subject, that I know the need of the students, and I have curated the content of radiology on this Acexam platform in such a way where I'm keeping all the text or the video content in such a way where I would not just be covering the questions for the NEET, AIIMS, but also for the next exam, where I would be discussing about a lot of concepts which will really help you for the next exam. Once you finish with your video content on this Acexam platform, I would recommend you to go with the general radiology first, as we already discussed. As soon as you finish that particular chapter or topic of the general radiology, just go through the questions, because the questions have been curated in such a way that we cover that particular topic or system completely. So the questions are divided in such a way that you would end up covering the entire topic just by reading the explanations of those questions. In addition, whatever notes you have gotten, you can just add a lot of information from other platforms as well. So what you need to understand, that when you would be able to finish this much, the next thing you can do is test and discussion, where you can attempt all the questions of that particular subject, and then you would get a rank amongst all the students who are subscribed over this particular platform, which will give you a reality check on like how deep or in-depth knowledge you have about that particular subject. So in addition, what I would like to add, that nowadays image-based questions, as you know, is a very normal thing. Like in all the subjects, they are trying to ask more clinical-based questions where they are providing images. And take my word on this thing, that probably radiology is the biggest source of image-based questions, because even if that particular question or disease which belongs to surgery, medicine, pediatrics or gynae, or for that matter any other branch, that image essentially is still a radiological image, like CT scan, MRI, ultrasound. And if you understand the principle, if you can identify that on that particular image, what image is this, that's the first step. If you can identify that image, and then if you can pick the pathology, if you are able to do that much, only that much, even if you do not know anything in-depth knowledge about the disease, you would be able to answer. And take my words on this, that you should be able to answer 80 to 85% questions just by understanding the principle of radiology. If you start counting on those things, I would say there are at least 30-35 questions which have been asked. So in the recent examinations, when you read or hear from the toppers of the INI, CET, NEET or next the FMGE students, they all say that it is very essential to cover radiology. Well, because nowadays, because of the IBQ, the image-based questions, a lot of questions are being asked, and you can easily cover 35 questions, just image-based questions, just from the principles of the knowledge of radiology. So this is very important. Just on the lighter note, what I used to do while I was preparing for my exam, everyone has got their own way of studying. So what I pressurize that always try to read the questions in totality. Means just don't read the question and ignore it. Just go through the choices as well. Tend to read all the choices. Sometimes you get hint from the choices that what question is trying to ask. And when you see some image, try to see all the corners of the image, because sometimes very subtle findings are there here and there, like mentioning right and left. Sometimes you think you from your knowledge, you know that this side is right, while on X-ray film it is written left. So you have to follow that left because it's written there. That's what examiner want you to look at, that despite the fact that image has been placed the opposite side or the other way around, the L is written on this side, that means that side is left. So those are the things you need to take care of. And I used to attempt, when I used to go through the entire question in totality, and if I'm able to rule out, let's say 50% choices, I definitely would go for that question. So tend to attend as much as possible questions, because I believe in that basic principle of mathematics that you would be awarded negative -1, but +4 for every right, while just -1 for every negative. So you have almost, after every 5 question, even if you're getting 1 right, you would be able to, you're still at par. So if you are able to rule out 50% of the choices, at least go for that particular question. That's what I would say. I used to attend as much as questions possible because of this basic calculation. And then on this Acexam platform, we have created chat boards, as well as there are comment boxes where, in case if you have any doubt, not just for radiology, we would be available 24 hours to answer your questions, not just from the radiology subject, but for the other subjects as well. So use this platform in the best possible way. Go through all the notes where you can add further information from the other sources. Go through all the questions, then T&Ds. Everything is organized in such a way that if you go through as per the planner, you would be able to finish the subject so nicely that you can answer pretty much all the questions. So I'll just wish you very good luck with your preparation, and thank you.